Hello, everybody. Welcome to today's podcast and today's webinar about digital patient and digital front door. So I'll be pleasured to be able to speak with you today and share a few thoughts around digital front door for a doctor's office and patient engagement, and what does technology mean for today's local practice. So I am Mike Oliver. I'm with a company called PracticeSuite. We have an EMR. We have a practice management software. We have a patient engagement software that really brings patient experience into the heart of your practice. So today, what we'd like to talk about is what is a digital front door for a doctor's office or a clinic. I'd probably liken it to this. Providers today have a lot of work to do among providing care to their patients, right? And making sure that patient care is centric to their experience of the patient and of the practice, and that we do everything that we can to empower patients to have better health. One of the things that doctors face today is this challenge of how do I become more connected to the patient? How do I become more versatile in the technology? And when I look at most patients today are like you and I. We're consumers. We consume everything around us. We have digital devices that connect us to all our favorite services, all our favorite experiences. And when it comes to healthcare, it's always had a little bit of a disconnect, meaning that I can't get healthcare in the same way that I use technology for other things. And so, if you're part of this and you're thinking to yourself, what does a consumer in healthcare look like? I'd probably ask you to say, what do you look like as a consumer? When was the last time you made a purchase from an app? When was the last time you made a purchase from a website? You maybe have shopped today and bought something, put it into your shopping cart, and it's going to arrive tomorrow. But when you look at healthcare as a patient, what type of app or technology enables you to be in control of your healthcare? And I think when we look at that, right, the digital front door of being able to schedule my own my own appointments as a patient, or choose and research the provider's care that I want to interact with, or fill out digital forms for myself, right? That digital front door tends to be a lot of locked opportunity, meaning that I have to call the doctor's office, their front desk, to schedule an appointment. When online, I can go buy something, put it in my cart, and have it show up tomorrow in a matter of seconds. So for a consumer in healthcare, oftentimes that experience feels disconnected. I'm kind of a veteran of the software world in healthcare, and for the last 20 years, there's been a term called patient engagement. And the whole term focuses on how do we bring patients and that engaged experience to their self, to their device, to their reality. And 20 years ago, it was something simple like sending out a postcard to remind a patient when they had an appointment coming up, right? And then it merged into sending out texts. And then it merged into other things. But when you look at today, that experience of having a digital front door or a storefront that is connected to the patient needs to be real time. For patients and for providers, there's a strain on both sides of the equation. For providers, they're stretched in providing, good care and good experiences to the patient. The provider is facing challenges with reimbursement. They're facing burnout. I mean, we just went through COVID, right, where all the providers were really stretched in their resources and doing more with less. And so when you look at that digital storefront and leveraging technology, the focus for a provider should be, how do I use that technology in my clinic to do more with less, to give my front desk some reprieve, to give my patients a better experience? So today I'm joined with a couple different hosts. You're going to hear from us all today. I have Travis, who will do a few demos of our product to kind of help you understand how does the patient engage with the front office, and then how does the front office see those materials and those engagements when they do patient check-in, when they review schedules, when they look at some of the billing aspects, right? Because all of that is connected in that front desk experience or that digital front door. As well, I have Matt. You'll hear from Matt where we will show you what an app looks like on the patient side. where I can schedule my own appointments, where I can fill out forms before I come in, where the doctor's office can ask me about my own health experience so that when I come in, it's natural and I can just scan in and automatically be logged in for my appointment. So there's a lot of different things that for the patient experience and for the automation within the practices, those two experiences can be joined through Digital Front Door. So we look to show you a lot of these demos and technologies today. So stay with us as we go through them because I think it's very meaningful. The other key thing on this is that every provider's office and set of patients are different. So as you look at our technologies today, don't pass up an opportunity to reach out to us and schedule a one-on-one with one of our consultants who can go through your practice, your challenges, and look at some of these technologies and how they might apply for you. So with that, let's just kind of go back to what patients are doing today. We know the providers are stretched, but for the patients, there's also a lot of barriers to entry, right? There's a lot more being put on patients to manage their own journey, to manage their own healthcare. And so we feel that the Digital Front Door through technology should serve both the patient and the practice to have those shared efficiencies. When you look at patients today and the surveyed patients around their healthcare experience, most patients feel that burden of care that's being brought to their level. Also, they're asking, hey, we want better care. We want stronger relationships. We want more connectivity to those providers in their clinics. And so the technology, I think, is what answers those questions. That's what allows them to be more invested in their care and feel that they've had that personal touch through that experience. So let's talk about the Digital Front Door. You've all been invited to our webinar today. You're all thinking about what is the Digital Front Door? How do I maximize technologies? How do I become that storefront to my patients, right? A Digital Front Door means that we're giving patients, through technology, a very centric approach to how they engage in their healthcare, right? It means that they can connect and they can see that value and that they have confidence that, for example, if I go schedule my own appointment, will the front desk see that? Can I show up with automation expecting for them to recognize me in their schedule? Nothing's more challenging than thinking you've scheduled something and then showing up and having that frustration that the doctor's office wasn't ready for you, right? So technology can help connect that, schedule that, and automate those experiences for the patient and for the practice so that the practice can do more with less. Let's talk about the need around the digital patient. You know, when telehealth happened, right, when it first came out a couple years before the pandemic, it was a great tool. But when the pandemic happened, it was a necessary tool. And you saw that those patient engagements and those patient experiences through telehealth and telemedicine went up 38 times in some instances, where there was that strong of an increase. And patients still have a connected experience or expectation where they can leverage telemedicine. So telemedicine is one of those technologies where you can now schedule in patients in the day, and you can see patients both virtual and in office. I know for my own personal care, I schedule often consultations with my personal doctor, and we do those over telemedicine, and it makes it easy for me to fit that in for my day, and it makes it very connected where I feel like that provider now has a vested interest in my experience, but also in my wellness, that they recognize that sometimes I have a busy schedule and the telemedicine is best for me. You know, the whole experience of patients needing the front door and having a digital experience to their front desk, that really changed through the use of technology through the pandemic, and that's really here to stay. When you look at some of the features that make a successful digital front door, there's a lot of things that go into this, right? Everyone will have their own opinions, but what patients want is a messaging application where they can message to the front desk. They can message to their providers, and they want it more in real time, where it's not just, hey, I'll send a message, get an email back. You know, they want it where I can chat with that provider. So when you're thinking about your own digital front door for your patients, challenge yourself to say, can patients schedule their own appointments? Can they chat with my front desk? Do they have a reasonable experience through telemedicine? Can we offer the patients before they come in? Can we look at the appointment type and ask the patient to fill in certain forms and patient intake forms? And can that registration happen on the patient's device before the appointment? And when you think about that, that creates those efficiencies at the front desk, where when a patient checks in, they can just say, hey, I'm here. With an app that we will show you, we'll show you how they can just be scanned in off their device. They can show you a QR code, and it sets all the triggers in the clinic to say that patient has arrived. Do they have eligibility? Do we have all their co-pays? It'll automate all of those things for your front desk to make sure that there's that connected digital experience in-house, in clinic, right? Now, the other thing that's really great is patients want to pay their bill. They want to understand their bill. But when you look at a lot of clinics will have an AR that's just expanding, and there's a lot of ambiguity around who owes what and getting that collected. But we know with patients, they want that connected way of making a payment. So for example, when an insurance makes a payment and there's a decided balance to the patient, can your system automatically reach out to the patient and settle up and ask for a payment through a secure payment link and collect that money and then tie that back into your report, so you know as a practice where those outstanding balances are and how to make sure the financial health of your practice as well. So the digital front door and digital technologies can do much more than just simply give good patient care or good bedside experiences, right, to the healthcare terms. It can also create good financial health for your practice and for your patients. I had an experience once where a healthcare system was reaching out for years in the reverse in an attempt to collect, and there was a lot of ambiguity around how that was even brought up years after the experience, or how it was actually derived. And so we need to have those technologies that are real time, that are right after the experience, where the patient understands, yes, I understand that there's a commitment on payment to you, and I'm willing to engage with you and make those payments. Now, listen, we're all involved in healthcare, and we know that outcomes and experiences to drive patient health is what is the ultimate target of every day why we are in the business, why we come to work, why we choose to deliver better care. When patients, it's proven, when patients are part of that connected journey, and they have that technology, and that technology brings the experience full cycle for them, there's studies that say that the outcomes are greater, that the health itself is greater, that patients have a better wellness for being engaged in their own health. So that's where also this digital front door is very meaningful to patients and to the experience that they have. So again, as we look at this and the collective experience, you need to look at the technology. And I asked you to think about your own practice. Do you have technologies that engage patients, that make it easier, that make it automated, that make it that connected experience through a digital front door type of experience? So today, because you've joined the Practice Suite webinar and we're showing you and talking about this topic, we're also going to show you what some of the services do through our automations, through our technology. Practice Suite looks at it in this lens. The patient needs to engage, the provider needs to engage. What are the technologies that do that? So we have a patient engagement suite with many of the services, with all of the services that I explained around patient self-scheduling, automated check-in, patient appointment reminders, patient payment reminders, patient intake forms. We have a suite through our patient engagement application, and that's the Hello Health platform that Matt will show you. And that allows you to have that technology that is engaging both on the patient side and the practice side. Now, we also have practice management. We have electronic health records. And we know through those experiences, and Travis will show you a brief synopsis of those, but we know through those experiences how the connectivity of a patient scheduling their own patient will show into your schedule. Will help your medical assistants and your office administrators know who's on the schedule, who's already been vetted for patient eligibility, who's already filled out their patient intake forms. All of that can be connected through a software and the calendaring of that software. So when we talk about the patient having their own experience on one side, maybe they're, on the drive home from work, or they're sitting at the movie and they're trying to schedule their appointment, that's one side of it. But the other side has to connect within the practice at the front desk. Otherwise, the staff would be lost on kind of delivering that continued value to the provider or to the patient. Now, also, we know that telemedicine has to be part of that. And we'll talk a little bit about our platform and show you a little of that. But we also feel very strongly that your medical office, the back end billing office, has to be connected with the front end experience of the patient. What I mean by that is if the patient self-schedules their appointments, if they fill in accurately their patient demographics, upload their insurance card, if they fill out the patient intakes, that is kind of the about me of the patient. And we take all that information and we append it into the patient file so that down the road, after they've come in for the clinic evaluation, after they've been sent out for billing to the insurance company, right? The medical billers on the back end and the revenue cycle management administrators can use that information to understand what was the patient's journey, what did they come in for, and then use that information in the outreach to the patient to try and make collection, to finalize those experiences. And we believe that that's a kind of a cyclical experience. There's many points along it, along that value and along that cycle, but in that cycle, those patients need to be connected and that experience has to be continuous. And so we feel like, our technologies will also help the back end as they seek to do a better job of collections for your clinic. Again, some of the features that we talk about in our patient engagement is that digital front door, those virtual check-ins, those QR code intakes, and this drives that whole acquisition or new patient experience. Know that anything that you do in healthcare, we hear this a lot, needs to be HIPAA protected and protect the patient's health information. And so that's one of the top securities that you get within the PracticeSuite services and technologies. So with that said, I'm going to actually engage my two favorite people to work with for demos. I have Travis who will jump on. Travis will show us a demo of the PracticeSuite billing and EHR, and then Matt will jump in and Matt will show us what does it look like from the patient side when they're self-scheduling through that digital front door, when they're utilizing an app to upload their own patient information. What does that look like? Is it consumer friendly? Does the patient understand the process so that it doesn't create issue for you and your clinic? And then Matt will also show what does the practice see? What do the providers see? And what does that front desk see at time of check-in, at time of patient care delivery? And Travis will show you all this in the scheduling as well. So without further ado, I'm going to invite both of Travis and Matt to share those demos with you. And then I'll come back in and we'll tie this all together. How do we bring this back to your clinic? How do we let your clinic have an opportunity to see these services one-on-one and to schedule a one-on-one personal demo or experience with one of our consultants to see how we deliver better technology for you and your patients. So I'll see you shortly. I'm excited that you've come to the webinar today, and we look forward to having these conversations with you in your practice.
All right, thank you, Mike. I am really excited to show you the Hello Health platform as part of our digital front door experience. So there are two parts to Hello Health. We have the patient portal, which is the screen which is in front of you right now. We have a Hello Health app available for patients to download. It's available on Android as well as on iOS, so patients can be able to download the app and use it on the go. We also have the provider-facing side of Hello Health. We call that Hello Health Facility, which will be used by providers to configure what their patients will be able to see and do on their patient portal. all of these applications are synced with Practice Suite, and for providers, majority of their workflows will continue as normal in Practice Suite. So for this demo purpose, I'd like to start off on the patient portal side of things, and then I'll show you how providers will be able to see and maybe configure a couple of things from the Hello Health facility. Once patients have signed in, they'll be able to then see things such as their health records, make appointments, and so forth. The dashboard is where they'll be able to see such information such as any of their appointments, a glimpse of their health records, documents, as well as messages. The health records section houses records that are maintained in Practice Suite. So patients will be able to then see any of their allergies, labs, vitals, and so forth, and access things such as their clinical summary, visit notes, as well as all the other documents which will already be in Practice Suite, and they'll be able to see them right within Hello Health. The Appointments tab is where patients can be able to then make their own appointments. They'll click on Make an Appointment, they'll see all their providers, then they'll do the appointment booking process. Select the location, select the appointment type, and then put in their reason of their appointment. So once they have done so, they'll be able to then select when they want to go in for their appointment. They will select the date and time, and then based on the available slots, they'll be able to see them here. All of this information is coming from Practice Suite on the scheduler, so they'll be able to see what is available on the scheduler. And once they have selected the time and date they want to have the appointment on, they will then click on Next, look at the pre-confirmation screen, and then if they have any co-pays, they can be able to settle those right within Hello Health. And if not, they can click on obviously Pay and Confirm, and they'll be able to see those to pay in person rather. So once they have clicked on confirm, they'll receive a appointment email, reminder, or text, and they'll be able to then manage their actual appointment. So all appointments will appear in a tab like this, whether it's one that's booked by a patient from the portal or one that's booked by the practice. They'll be able to see the appointment date, the appointment status, and some appointment details. When they click on view, they will be able to then see their appointments schedule. They'll be able to do things such as being able to reschedule, cancel, and even check in for their appointment. And if they have any forms that they might need to fill out, they could be able to then fill out those forms and click on submit. Once they do so, these forms will go straight into Practice Suite and you'll be able to see them under the document manager. The messages section allows for patients to send and receive messages from their providers. So this is a one-on-one interaction between the provider and the patient. And if patients need to settle any statements, they can be able to see them right within Hello Health, and they can be able to then pay them off. These statements are generated within Practice Suite, and patients can be able to view them, they can download them, and they can use the Pay Now functionality to then pay or settle any of their outstanding amounts. And all of this will go into Practice Suite, and you'll be able to keep track of it within the billing aspect. Other things that patients can be able to do within the patient portal is access things such as adding the insurance information and sharing that with you, being able to edit and add that demographic information, and also ensure that they can be able to share those with you. Moving over to Hello Health facility, which I've mentioned is more of a provider facing side of Hello Health. In Hello Health facility, providers will be able to see things such as their appointments. These are the appointments that already be on the scheduler in Practice Suite. They'll be able to see them here. But most importantly, we did touch on the forms, right? So be it intake forms or any forms that a practice wants patients to be able to fill out, those can be built into Hello Health, and they'll be able to share those automatically alongside appointments so that patients can be able to fill them out from their patient portal. And once patients complete these forms, you will be able to see them under the patient forms here in Hello Health facility, where you'll see all of the forms from all of your patients. But most importantly, these forms will be accessible within Practice Suite. So under the patient's document section, that's where you'll be able to then see the forms that patients have filled out in there. So broadcast messages is a way that will ensure that providers and practices are in touch with their patients, being able to send these via email, text, or both. These are messages which can be sent, obviously, if a provider is away or anything of the sort, and they can be received by patients who are not even on Hello Health. So that's the great part about broadcast messages. Obviously, they are not related to reminders. The reminders here in Hello Health are extremely customizable, and they can be sent out as frequently as you would like for them to be sent out. They are sent out immediately after an appointment has been booked, cancelled, missed, hours before, days before, and you can customize everything to the actual text, which will be contained in the actual appointment reminder, and your patients will then receive that so that they're informed about their appointments, and they could be able to then click on the link to fill out any forms, reschedule, anything of that sort. Just similarly to how we saw that patients have the ability to send messages to providers, providers have the ability to do the same, receive and send messages to patients. But most importantly, this entire messaging module is available within a Practice Suite, allowing for providers to be able to ensure that they are able to receive and send out messages to their patients. They can send out forms which are built into the system for patients to fill out. They could be able to even attach other documents in the messages to allow their patients to be able to receive those and get in touch with them. Last but not least has to be the appointment settings. Here, we'll be able to decide whether you want patients to be able to even schedule an appointment or not, whether they're new and existing patient, whether you want them to have the ability to reschedule, cancel, or even check in for their particular appointment. And then there are multiple things that one can be able to edit. They could be able to go in to further edit which appointment will be available on which days, between which times, and so forth. So the patients will be able to follow the schedule that you set here in Hello Health when they are scheduling their own appointments from the patient portal. Up next, I really want to give it over to Travis, who will now show us how this will then now translate into Practice Suite, how you could be able to see the forms, how you could be able to see the appointments on the scheduler once a patient makes them. So I'll give it over to Travis right now so that he could be able to show you that part to obviously complete the entire digital front door experience, showing you all of this from Practice Suite. Travis, please take it away.
All right, thank you, Matt. And as you mentioned, I'm going to be showing you all how to actually see how this digital front door functionality flows directly into the EHR of the program. Now, on the screen shown here, I have our actual scheduler. And in this case, being as though we saw that the patient that Matt was working with was Jerry Jefferson. We created that appointment with the flu reasoning type, and it shows directly within the schedule here under the appropriate provider. So it shows all of these actual patients' name, correct appointment information, along with any and all information associated with that particular account, whether it be the insurance information, any balances owed at that time. You also have the ability to enter in any new payments, take a look at the full ledger or a full roster of all charges, payments, and adjustments for this particular patient. You have the ability to see eligibility within the system and even see the full schedule history of the patient as well. If you wanted to review the specific demographic and insurance information that was captured through the portal or even other correspondence, you have this handy demographic sheet report here towards the bottom of the screen that will allow for you to end up showing all of the information that you have on that patient demographic wise on this form. You can present it to the patient so they can confirm and or make any adjustments to the specific information, and the front desk executive can then handle it accordingly. But very helpful feature in this particular instance here. But again, you'll be able to see that information. You can check the patient in, out. You can see their full status here. And even from the screen, there is a helpful menu. When you just tap on the appointment alone, those same features that I just showed you within the schedule command center there are all available around in the banner of the appointment. So if you don't want to open up the appointment itself, you don't have to. You can just hover over the actual options here to see exactly what they are and go from there. But now, since this patient has been checked in, all information has been gathered for them, any payment has been collected for them, and so forth, we'll be able to move forward to the clinical aspect to see exactly how this patient can move forward in their appointment. With that, we'll be going over to the clinical desktop of the system, which is going to be for the EHR. This will show you a dashboard overall of everything clinical in reference to the patient, and shows you even the upcoming patient's appointments, just like so here. Any recent charts that may have been accessed by the actual staff there. You'll see summaries in the middle in reference to everything going on electronically and clinically for the patients there. Now, in this particular workflow, what will happen is that the nurse or medical assistant will be able to see under this appointments tab all the patients that have actually checked in for that given day. They'll be able to come here, choose the actual patient in question, specify exactly what exam room they're in. Then they can even click on that patient's name, which will take them directly into their clinical chart. This will show all of the information for that patient clinically that has been captured. You'll be able to see any information in reference to family history, problem list or previous diagnoses, past medical history, medications, allergies, etc. This screen is customizable, so depending on how you would like to have it set up, we will be able to adjust accordingly. But in this case, we'll go here to the current encounters so we can document today's visit. Now, in this case, we have a couple of different options to choose from. We have the ability to choose from a specific encounter sheet or a specific encounter template that we have customized for your liking, or we can just choose this little crooked arrow, which will change this drop-down menu to follow-up chart. Once we see follow-up chart here, it will show all of the previously completed dates of service for this patient specifically. When we choose one of these dates and hit the follow-up button here to the far right, it will then show us all of the actual information that was captured in that visit and fill it out on today's date. So this way, anyone who is handling or manipulating the patient at this point can go through, make any appropriate adjustments at that time. Anything that needs to be added to or taken from the actual listing can be done. So you can do so just by making appropriate selections, just by taking certain things off. If you wanted to add certain things in, just click in the specific area and make your appropriate selections as you see fit. But after the information has been added into the system here, certain things have been adjusted. Of course, you'll be able to go through, add anything you need, and then that nurse or medical assistant can hand it over to the responsible party, whether it be the provider or whomever may be next in line. Now, when they access this chart, it will come directly back to the screen here, exactly where they left off, and you'll be able to pick up, add any diagnoses, exams, prescriptions, so forth to the actual visit, CPTs as well. But once all the information has been captured, even beyond that, you can take a look at the document management tab here to the far right. That will show you any and all documents that have been uploaded to this patient's chart. Namely, you'll see here to the far left, there'll be an HH patient forms option that will show you all of the actual forms that have been captured on the portal for those patients. So once you're here, you're able to see those by clicking on the view button to the far right. That will bring up those particular images for you so you can see exactly what images have been, information rather, has been captured by those patients through the portal on themselves. So there's no extra or additional work that you have to do to get that information to come in and be documented appropriately. This system does all of it for you. So again, you'll be able to see that directly within that patient's chart to view and see exactly what you need in this case. But if everything is done appropriately, everything is listed the appropriate way, you can also view that there are other options available here as well. In the event that the visit that you have is not just a physical visit, it may be telemedicine, you have the button here in the upper right that will allow for you to access the telemedicine feature as well. So this will show you the specifics of that particular patient and send them a message indicator letting them know that the provider is ready for their visit. That message will also house a link that will get them directly here to this actual telemedicine visit. But as a result, the providers can then move that screen all about the appropriate screen there and then add any notes if necessary to the screen as they're seeing the particular patient on that telemedicine visit. So it's just another option that is here and available for your liking. But again, once all information has been documented accordingly, you'll be able to see that you can then click here in the upper right-hand corner. This will allow for you to mark this particular note as complete. It will then show you at that point in time a print preview of all that has been captured in this particular visit along with any electronic signatures for the provider rendering services towards the bottom of the screen here. But thereafter, anything that has been captured for the patients as far as CPT diagnoses will all be done and handed directly over into our billing area. So you'll see here under the charges and in the enter charges screen, the specific information for that data service that has been captured will be here. I'll just select all legal entities so I can incorporate it here, and we see under Jerry Jefferson the information that we've added directly here as far as CPT, diagnoses, place of service, etc. Now we see everything has come together in one full circle. We see how everything starts as far as the patient engagement tool. The patients can go through, add their own accounts, update existing ones, add their own appointments and so forth, and then fill out any forms directly needed for the EHR. But you can come directly into the EHR, check in, be seen, and be checked out directly within this practice along with these particular charges thereafter. So again, everything full circle and pretty simple and easy. So thank you again for your time and attention for the presentation. Now back to you.
Welcome back from the demos that we've done from Travis and from Matt. We've had a great session this morning as we've talked about the different services and products and things that we're enabling for offices as they look at how to create a digital front door. As we went through the product, we just want to tell you thank you for joining today. I know you'll have lots of different questions. Our questions we can help you with will be a few things. As you saw in the demo with Matt went through many different ways for how you check in with patients, check them into your schedule, validate what their process is within coming through your practice. Think of that. We want to show you that as a demo for your own clinic. We'd love to get your team, your staff members on a call, talk about the challenges you have with your patients and how to make this a reality for you. Also, think about the demo and the products we saw today with Travis. Travis was very informative as he went through the billing platform and how we look at scheduling and how we look at patients and understand how we collect the most. Remember that after the visit for your practice, it's really important that you have a very communicative effort to be able to follow up with patients on their care, but also to be able to try and get a status of their collections. So today we invite you to do a couple things. Fill out the form that was attached to this demo invitation and meet with one of our specialists. We'll review your practice, we'll review questions you have, we'll let you look at some of these products, we'll customize it while we're on the screen with you so you can see how it works for you and your clinic, and then we'll give you the option to decide that value. There's a lot of questions around how this works for your clinic individually. We know you're an individual clinic with lots of different needs based on the needs of your customers. So give us a chance to talk with you. You can email us directly, you can call us, but get in touch with us today. We'd love to give you a chance to see the value that we think we can offer to you and your patients and your staff. Thank you. Have a wonderful day. Hope to talk soon.